welcome back to Healthy Happy Hour. It's Angela Berg, nurse practitioner here at Care for the Kids. We have some special guests with us today that I'm very happy to have. Emmy from social work and Rachel from our patient financial counseling team. We are very lucky to have such great teammates on the team here at Care for the Kids, especially during this time when we're looking at people being so stressed about the changes that we're going through government-wise and just generally in our lives. People are worried about losing their insurance benefits, changes to insurance benefits, so you may not lose your insurance fully, but you may lose benefits. And there are some important resources and information that we want to talk about because preparation is worth $1,000,000 these days when it comes to knowing what kind of things to be thinking about now, so that if these challenges come your way, our hope is to give you some good ideas, working together with these smart ladies on resources you can have to be ready for such a thing. So first off, let's kind of talk about the insurance loss. And Rachel, you'll probably be the one to answer best. When people lose their insurance from an employer, for example, they always have the opportunity for COBRA. But we know from our experience that sometimes COBRA is not even a financial reality for them to be able to afford, because going from a employer provided health insurance to having to pay $100 or $1,000 a month if it's a family might not be reasonable for somebody, especially if that insurance loss came with a job loss too. What are some of the things that you think about when you are helping families navigate this kind of situation where the insurance is lost, kind of what some of their best options are?
Sure. So we do like to explore what's available for the patients. So we will start with a conversation with them to try to ascertain what their demographic information would be, whether or not what they could afford, say if we needed to research an insurance plan on the marketplace, or even give them the opportunity to apply for Medicaid. And sometimes neither option is available to the family, so we may research some other alternatives based on the patient's diagnosis, because there are multiple programs available that will help cover, say, the COBRA premium or even just an insurance premium from the marketplace based on their diagnosis. So we do have several options available to us for those families, and we just make sure that we just, search what options are available based on, like I said, diagnosis, income, and just the very options that may apply.
When we talk about the marketplace, if we just Google Nevada Insurance Marketplace, is that how we navigate our way to the website to be able to look at those? We're really talking about what people refer to as the Obamacare plans or the ACA plans, right?
Yes.
And it's a centralized clearinghouse for that. Is that the best way to
Yes,
get there, you think?
healthcare.gov is the website that you would go to. And we've noticed that, there's been several families with we've cautioned certain plans to make sure they ask specific questions, because these families that may lose their insurance because their child has, this diagnosis that will be something that where they may need infusion, high cost medications and things like that. Ask those questions of the insurance company to make sure that that they'll cover that prescription, because we found that there have been what they call limited plans out there where the broker may tell the family, oh, you'll be completely covered, you won't have to pay anything out of pocket. These plans don't carry a copay, a deductible, or an out of pocket. So there's no way where you're paying $400 a month for this insurance, yet you have no financial responsibility. Well, what families are finding is once those claims are processed, they are hit with a very large balance because the insurance is limited. It only covers an office visit. So it won't cover your labs, it won't cover x-rays. You're basically responsible for everything. So it's more of like a discount plan. Mm-hmm. So we make sure they ask those hard questions of that insurance company. Will you cover this medication? What prescription or what pharmacy do I need to use? Will it be in network, out of network? Mm-hmm. Is my doctor in your plan? Those are questions we want to equip our families with to ask the insurance to make sure that they'll have that continuity of care.
Right, and it really sounds like a well-prepared family should ask situational-based questions, like say, okay, if I go to my doctor at Care for the Kids and they order an infusion medicine that has to come back for infusion, so that they actually put them in a position to have to answer for a real life situation, then they'll get a much more trustworthy answer, probably. Kind of like that we've said before on the series, trust but verify. You want to have a trusting relationship with these folks, but if they don't know the specifics of your situation, it seems like we have to put them maybe in our shoes so that they can really truly answer, because I'm sure the salesperson in all of them wants to say, but you have no copay. Well, I have no copay for the office visit, but what you're not telling me is the infusion doesn't count in the office
Exactly,
visit.
yeah, because there's just so many alternatives to insurance plans that there's just so many options out there that you may not know what questions to ask. So we definitely invite our families to give us a call. Ask us, what you need to know to find out what coverage is best for you, because this is the medication your child is on. You know how often they receive it, if they need it every month. And if your insurance doesn't cover that, then that's going to be out of your pocket. And not everyone can afford, a high cost medication or a monthly med. But then we also have, other alternatives with the manufacturer. So there are copay assist programs. Yeah, so we really try to just exhaust every avenue available to make sure that the patient stays on their meds.
And we have a time frame too to think about. Don't they usually have, is the rule 30 days that they have to make the decision about signing up for COBRA or not? So we have to figure out if there is a resource to help them with that COBRA expense pretty quickly.
Yes, that's about accurate. I believe they do give them about 30 days in order to make that decision. And that's a tough decision to make, because you have your mortgage, you have your groceries, your child needs care, and now you don't have insurance.
Yeah.
And now you may not have employment either. So
right.
like I said, we do welcome those calls from the families, just to let them know there are resources available. You don't have to fend on your own for this.
Right.
Please let us know how we can help you.
Right, and I think it's really important, Emmy, you work with Rachael a lot, you and Claudia, so we are blessed with 2 social workers here, and we have 2 financial counselors now. Rachel, you have a partner too. Yes, so far we have 2 and 2 that are really great resources, and I know that you guys work together a lot to find these resources. I know Emmy and I have had some conversations about parents networking and some of the challenges that come with parent networking in the social media days, now that a lot of parents are connected on social media. One of the conversations you and I have had just in this last couple of weeks have been about a parent's experience. Does not necessarily mean that that resource isn't available for someone else if a parent shares an experience. So Emmy, you might want to talk about the kind of the precautions we talked about that we say to people. That's one person's either great experience or bad experience. Oftentimes it's bad experiences. Those seem to get more attention, but that it doesn't make it a rule.
Yeah. So when social work has the opportunity to meet with families, we try to hit on certain areas to make sure that there's considerations being made about that, especially if it's a new diagnosis and they're about to enter in this medical journey that they've never gone through. We want to make sure that we're kind of identifying some of those points like insurance and employment and family support. And I think it's really important for families to feel connected with other families that are going through similar situations, feeling that way they don't feel alone in their medical journey. But it is true that I think we all have to kind of take every patient or every child's experience and diagnosis and treatment kind of, individually, and kind of considering everything that is part of that family and that child's life. And so, I think just being careful about when they're connecting with other parents, to have that support by sharing their experience, but not necessarily taking their specific experience, to heart when it comes to your child's experience, because it might have a different nuance that is going to be different for their child's medical
Right,
journey,
right.
whether if it's good or bad, but
Right.
just being careful about that and making sure that you're using those support for emotional support
Yeah.
and not so much to guide kind of the full like medical decisions or
Yeah. Yeah.
the next steps for their journey too.
Well, and if you're pretty limited about if that's kind of third-hand information, if it's sharing information about the use of a resource or an experience with an insurance, that might not apply to you. So that's really important for
True.
people to consider if it doesn't apply to you. I know there's lots of different resources that we need to think about too. And Rachel, you talked about those a little bit too. Let's dig into a little bit of resources. I know one of our biggest challenges, I think, is transportation. And when people are dependent on public transportation, we're not really well developed in public transportation here in Southern Nevada. And so that becomes a really big challenge. I know they're not big on public transportation in Northern Nevada either. I shouldn't just say Southern Nevada. We're challenged here. And so some of the things are that come to my mind are thinking about when we have to send a patient out of state for things like transplant. There are times, maybe you can talk about it, Rachel, that parents should know at the beginning of the journey maybe to reach out and look at what is their coverage for any out-of-state care if they have to go. Sometimes transportation and lodging is included if it's a transplant benefit, and sometimes not. Kind of what has your experience been with our patients that we're serving here at Care for the Kids?
Well, in that particular situation, we still lean into some of the resources because, you know, a lot of the programs that we both use, they will help cover families, you know, based on that diagnosis. They already know what the struggles may be. So they will include coverage for lodging and meals up to a certain dollar amount each day. And just to make sure, you know, the family gets some gas money and things like that. So that's where the PFCs really lean into social workers to help navigate and bridge that gap to make sure that the patients can get to the next state for whatever services that they need.
Yes.
Yeah.
Until we conquer all and have all services here so no one has to travel, which would
Yes.
ultimately be a Cure for the Kids dream come true.
Yes.
We will continue to navigate these challenges together, but it's so nice to know that there is a village here at Care for the Kids that we've created by being able to have specialty positions like yours to support this care that we are able to do. What other kind of resources do you think are important, Emmy? I think both of you have alluded a little bit to some disease-specific resources that may be able to help. Are there places like I feel like the rheumatology patient population is particularly challenged? The WISH networks don't necessarily accommodate a chronic lifelong disease very abundantly. There are not as many financial programs through nonprofits available to them. Can you kind of talk a little bit, Emmy, about your experience with what kind of resources and what a parent should think about when they start thinking about needing some to add to their village to find more resources to help them?
So going back to when we meet with parents and caregivers to kind of address or spark conversations about certain things they should be keeping in mind when they're going through their medical journey, we do start with, where does the child live? You know, is it in one household? Is there split households? You know, what are the caregivers available for support? Who's bringing them to clinic or other appointments? Who might be available to watch the other siblings if there's other children in the household? And, you know, what does that kind of structure look like? Because especially if they're entering into a chronic disease or oncology and is something devastating like that, it's going to flip their world upside down, at least for a little while. And so we start there, and just to kind of spark those conversations, and what does communication look like between parents? Who's going to be accompanying them to the hospitals, and who's going to be staying home or working? how does it reflect on their jobs? What kind of benefits do they have with their employers? Can they get FMLA? Oftentimes we try to talk about, usually one caregiver might be the medical caregiver, and then the other caregiver is working if there is two-parent household, but sometimes we have single-parent households, and that it becomes very challenging to navigate income, employment, and appointments. So we start there, and then we do go into kind of, checking in with the siblings and families' mental health and emotional health. How is this affecting their dynamic? A lot of the attention's going to the child that needs that medical care, but what does that mean for their siblings, and what attention, do they need? We'll talk about school too, to make sure that their school has the ability to accommodate their medical situation, or if they need to take time off, or by having homebound education while they're going through treatment. Those are some of the examples and opportunities we'll talk about to make sure it matches that family.
One of our additional village portions that we've been able to add is the classroom here, and that partnership with Clark County School District to be able to make sure that kids continue education the best way that they can while they're through the medical journey here at Care for the Kids, and I think that's important. So it sounds like really overall knowing who your village is and making sure that we, that's another change that the world has kind of had, is that people used to have really big villages that were surrounding their family, and we talk about family Thanksgivings and things like that now that we make additional family, but I think that becomes really critically important when we're thinking about going through challenging times. I sure appreciate the both of you sharing time with us and sharing time with the Healthy Happy Hour viewers, sharing ideas about resources and things to think about. I think being more proactive is as important as ever. And as we were talking about resources, and we're talking about how resources are very diagnosis specific, I talked about the challenges that there are maybe more abundant oncology for pediatric cancer patients resources. What are some of your ideas and thoughts for people to think about for other long-term chronic conditions, besides simply what we always talk about is advocating, be active, get involved in your community, advocate for legislative things. Legislatively is how we change how we're able to create this care for our kids. But what other ideas do you have, Emmy, about?
So when we meet with the patient, we usually kind of figure out what resources are available to them. We'll look at the insurance and what benefits come with the insurance. Sometimes some insurance can provide some transportation assistance for families and other added value benefits that we'll kind of highlight so that families know about it. But the critical things that they usually need, which are financial assistance for, co-pays and medication and transportation to get that medical care, that does become pretty sparse when it comes to non-oncology diagnosis too, because we do have really great partnerships and locally here with oncology groups, and nationally speaking there's a lot of opportunities to kind of apply for different assistance for transportation or financial assistance. But we talked a little bit about rheumatology when we brought on rheumatology to Cure for the Kids. As a social work team, we decided to kind of, connect and reach out to different resources. And it's still a work in progress in that community, we think. And like you said, advocacy definitely is on the top. But for those patients, now we have to be a little bit creative in figuring out, okay, what insurance? Can they get the transportation assistance from insurance? If they don't have that ability, or they're out of an age range for another organization that they can help with, then we're now looking at internal resources too. And so we've had to be a little bit creative in asking our development team here, our donors and supporters, to kind of help, offset those costs for our patients here by being able to provide transportation, at least to our clinic, through our gas card and Uber program. That's for emergency use. But because we know that there's no resources in the community, we'll try to advocate internally to see if there's any resources that we can funnel towards the conditions or patients with those conditions that wouldn't have those access to. So I think as a community and as family, we just have to be a little bit creative, in addition to advocating on a macro level. But I think also vocalizing those needs. I think the more people know that there isn't enough support, I'm hoping that, the more voices are being heard, that there's a little bit more ability for even small organizations to pop up and say, we heard you, we want to help with the transportation. So now we're going to fundraise for just transportation for rheumatology patients, or anything like that would be very helpful, even if it's a few $100s, a few $1,000s would go a long way for a lot of these patients that have to come to the clinic pretty regularly.
Yes. I think our development team are often the unsung heroes because they do really recognize what unmet needs we have to be able to continue to do the work that we do every day, and be able to do the things that aren't traditionally insurance covered. I mean, we talked a little bit about what are typical benefits, and that co-pays and co-insurance isn't the only thing you have to worry about. There's a lot more that goes into co-pay, co-insurance, one parent not working and having to go on an extended leave, cutting your family income in half. There's a lot of those needs, and our development team is so amazing at trying to make relationships out in the community to really help us develop. And it's a Cure for the Kids way to develop a program where we find the need, and there's naming rights available for that. There's all kinds of options available, but we have been really blessed with a community in Las Vegas that does recognize the need for keeping support local, and that we do have a big local need for supporting patients through chronic and acute disorders with their children alike. So,
and I was going to say, just like Rachel said earlier, that sometime for families making decisions about their medical care is a lot more challenging than just saying, we know our child needs this and we need to do that, because they might be dealing with a housing crisis, a transportation issues, family issues, and that becomes very challenging, and insurance issues, and that becomes very challenging for families to navigate in general.
Absolutely. I think what the two of us do in our own individual and then collectively as well is just really find out what the social determinants to your health are. We need to know how best we can help you, because we want to make sure, number one, your child is taken care of, first and foremost. And I think that's what a lot of families find is very different at C4K. It's not about the dollar first. Your child's health means more to us than we could express to you. So just in speaking with the families, it's like, Mom or Dad, I understand, please give me this information. It's very personal and private information that they have to share with us, but it's for your benefit, and we want to make sure that your child stays on their medication, that you can pay your mortgage and your utilities. There's a program for that. Just let me know, please. Just and I love, what we have to offer internally for our financial assistance. It's not just, what the community gives, but C4K gives so much to the families. We saw the need for PT assistance, so we created that program. We have so many things under the charity care umbrella, just to make sure that families can just live.
Great examples. And live focused on your child and not focused on the disease. Let us fight the disease. You fight for your child alongside us, and we're walking this journey with you. That's so important. I appreciate the two of you joining us for Healthy Happy Hour and being able to have the opportunity to highlight some incredible talent that's part of the village here at Cure for the Kids, that is there for each and every one of our kids and families that we care for. So thank you both so much for sharing every day and working hard every day for our kids and families, and being here to share a little peek into what you do here with us on Healthy Happy Hour. And with that, we're going to wrap it up today, and we hope you enjoyed. Again, please keep watching. Let us know what topics are important to you, what other kind of information we can bring to you, and we look forward to seeing you again really soon on the next episode of Healthy Happy Hour. Take care and stay healthy.
National health. Well, well. emotional.